I'm getting any further. Oh no, my video just stopped on me. We're gonna have to do this in 2 segments for whatever reason. So periodontal disease is essentially dental disease, and it's just bad news. Fractured teeth. Fractured teeth are teeth that have broken or fractured. Whether that be mid-crown or at where the gingiva meets the crown, or where it can be fractured at the root. We had a dog come in one time, a boxer, who got into a fight with another dog, and during the fight he had broken his canine tooth out of the root. Well, not the root. Right out of the oh goodness, what is it called? Essentially, he broke the whole tooth out of his maxilla, and it came out completely intact, the whole tooth, but it was just hanging by a thread. And so had we not removed it, he probably would have been in a world of hurt as far as like pain, minus the fact that he just was bleeding profusely, and we needed to stop the bleeding. We needed to go ahead and fix that before any other trauma happened. Fractured teeth can also happen due to dogs chewing on sticks and rocks and chewing on metal for whatever reason. Dogs are weird. They like to chew on whatever they can get their mouths around. They can fracture their teeth due to any number of reasons, but and then you have slab fractures, like I mentioned earlier. That's where they're just kind of like, even like a bone, like an animal bone, like you can give your dog a cow bone, not one that's cooked obviously, but a cow bone. They can just sit there and gnaw on it with those back teeth, those premolars and those molars, and then they can just hit it just right, and as they come down, that tooth just loses all of its integrity just in that one spot, and slab fracture, which is essentially the whole tooth, where when they bite down, a slab of it comes off, and then you have this exposed tooth with, and it's painful. It can be. The dogs are pretty stoic, and so they don't usually tell you that it hurts, so they just stop chewing on stuff for a little bit, and then when it doesn't hurt as bad, they go back to chewing when they're bored. And then they wind up potentially with another slab fracture. And usually, if you are in the area and you can afford it, in the area of a doctor like Dr. Paul May in Vidalia, he can put on, I think it's called a crown. Essentially, he'll just fix that slab fracture where that tooth is exposed, and but it's not good. It's not good news. So, while some dogs can live with them and be okay with them, others, they're pretty severe. Some of them can be just a little chip off the tooth. Others, it's where the tooth is literally broken like in half, and you only have just half that tooth, and sometimes you can be only like millimeters away from that nerve and that pulp of the tooth, and you really need to get that fixed. If it's so severe, and if you don't have the money to get it capped or a crown put on it, you would just remove the whole tooth. Well, it's not always necessary, but to get a crown, it is necessary to make sure that the overall health of your dog's mouth or your cat's mouth is important. I mean, it's the same idea with us. It is directly linked to our bloodstream. So, what else do we have? Worn teeth. Same thing. Chewing on stuff. Worn teeth are, they can be worn down due to the dog or the cat chewing on something that they shouldn't, whether it be a rock or themselves. If they have chronic itching, I have a veterinary dentistry book from last semester, where it has a picture of it. I wish I had brought it. but I didn't. It is a picture of this dog's teeth that are worn down to nubs, and it's just because this dog had such severe pruritus that he just chewed and chewed and chewed and chewed and chewed and chewed and chewed on his own body, that A, he had no more hair on that one particular spot that he chewed on, and B, he didn't have any he didn't really have much of a crown left on his teeth, and he just had nubs. He had worn them completely down. I may have mentioned this in my last video, but the Greyhound that I used in a lot of my videos for my jugular stick and my IV catheters, saphenous and cephalic, that spirit, before we got him, he would just sit back in his kennel while he raced, or during his racing years, just sit back in his kennel and just chew on whatever he wanted, whether it be bones or himself or toys or whatever furniture they had with them. He would just chew and chew and chew, and now, even though he's only like 6 years old, his canines are like half the length of what they need to be, just because he had such boredom, and he just chewed his teeth down to, like, worn them down to nothing, pretty much. So, worn teeth are not good because, again, you expose that dentin, that pulp, and that, if you get down to it enough, you can potentially expose that nerve, and it just becomes painful after a while. So, no good. Retained deciduous teeth. That's kind of, that is layman's term. A retained baby tooth. This actually has a very good example of it. You see the adult canine, and then you have a retained deciduous canine tooth. So what happens is, for whatever reason, the deciduous tooth did not fall out. They were supposed to fall out, but they did not. So that tooth just ends up sitting there behind the adult tooth, and will retain bacteria and retain any kind of food particles or whatever the animal has been chewing on or eating. It'll just sit there. And think about if you never floss your teeth. Well, what sits between your teeth? Crap, essentially. And you start winding up with periodontal disease, and so it just, minus the fact that there's just no room in the mouth to keep baby teeth, so the baby teeth have to come out. There's no room for the baby tooth. It is just retaining bacteria and plaque and gunk and calculus, and it's just wreaking more havoc than being in there than not. Most people say don't worry about it, it'll fall on its own. Well, what if it never does? Then you wind up with your dog or your cat having periodontal disease, all because we just kept one tooth in there. And it can spread. All that inflammation, it can spread. Tooth root abscess. That is essentially where the root of the tooth becomes abscess because something got stuck in the subgingival region and just got shoved further back toward the root, or down, whichever, doesn't matter, whatever tooth. It got shoved further to the root of the tooth and just created the perfect environment for bacteria to just fester and breed, and just camped out and made home. And as the dog or the cat continues to go about its daily life, it will sit there and just get worse and worse and worse and worse until that abscess starts to become so painful because of the fact that it has started to build up this purulent fluid, and it starts to swell. You may even see the tooth have a lot of bone recession because that bacteria is just eating away at the bone. And we've seen it where we had one dog actually come in where he had a tooth root abscess in his carnassial tooth, and it actually it abscessed through his cheek just under his eye. And the owners thought that maybe he just had a hot spot that he just kept itching at. No, he wasn't itching at his face. He was itching at the fact that his mouth hurt. He kept pawing at his mouth. They thought maybe that he was just scratching his face. He kept pawing at his mouth because his tooth hurt so bad. And it created an abscess. And we ended up having to go in and remove that tooth, clean it all out, and it ended up being so bad that we ended up just debriding the whole area, and eventually, if I remember correctly, this is like 3 years ago, if I remember correctly, we just ended up we closed what we could on the inside, so that way we didn't wind up with our nasal fistula, which usually isn't associated with the carnassial tooth, but we didn't want to create any kind of fistula. So we closed up what we could, but the abscess, where it abscessed out to his cheek, I think we just left that closed through secondary closure. And but he ended up making a full recovery. So while tooth root abscesses are no joke, they are a serious thing, but they can be fixed. Lots of antibiotics. And let's see. Oronasal fistulas. So oronasal fistulas are essentially a hole in the hard palate of the mouth where the integrity of the palate has just degraded away. And for whatever reason, say the dog has had, we usually see it in dogs. I mean, it's possible cats can have it, but it's not common. So say the dog got into a fight, had some trauma. That could cause had some trauma to the roof of his mouth, or even to his canine tooth. That could potentially cause an oronasal fistula. Or he has an occlusal, where or malocclusion, where he where his teeth don't close properly, and instead they close. We're gonna do it like this instead. These are my canine teeth. So say he has an occlusal where it comes in like this. So his mouth is a little bit crooked. Say he has an overbite, and his canine teeth actually go into his hard palate rather than just behind his maxillary canine teeth. They go into his hard palate. He could wind up with a bilateral oronasal fistula, which is not good, not good news. Lots of endodontic, if you will, surgery. So what happens is, like I said, there's a number of reasons for why a dog can wind up with oronasal fistulas. But what happens is you wind up with a hole in the hard palate, usually around the canine tooth, and you wind up with this hole from the hard palate into the nasal cavity. And because it's the nasal cavity, you wind up with saliva or bits of food or what have you, whatever the dog picks up in his mouth can wind up into his nasal cavity and into his respiratory tract. So if it's food, he could wind up with a lot of nasal inflammation, and potentially, if anything gets caught in there or stuck, even that just creates more bacteria that will sit there and fester, and he could wind up with an upper respiratory infection. So it's just not good news. So we have to go in there and just kind of clean it out and close it up. So that way, and when I say clean it out, I mean you're not going to flush it with anything other than maybe just some saline flush. But you're going to have your animal intubated, because otherwise you're going to wind up just flushing his respiratory tract and just drowning him, essentially. So you're going to have him intubated so that way he doesn't aspirate anything. We ended up having to do that with a cat who had an oronasal fistula. Like I said, it's not common, but it happens. And we had to do that with a cat. And once we flushed him out, Dr. Crawford ended up going in and just closing it up. And he ended up making a full recovery, but it took a long time. But that's essentially what it is. It's just the bone, because of either trauma or something chronic, just eating away at it or digging away at it. Like I said, malocclusion, that'll do it. And it's usually associated with the canine tooth. That hard palate has just degraded away, and the tooth is just, or the hard palate is just degraded away, and you've just created an opening from the mouth into the nasal cavity. And like I said, it just creates a whole world of problems. So as far as at-home care instructions, the dental that I did earlier this morning, it's actually one of the technicians here. It's one of her dogs. So while she knew what to do as far as at-home care, if she were any other client, I would have told her, just kind of give him some soft food for the next couple of days. He's probably, just like us whenever we get our teeth cleaned, we're going to be a little sore. Just around the gum line, just from digging at our teeth, it gets painful after a while. So he may want to eat some soft food for a couple of days, just for a couple of days. We don't want to keep him on soft food just because we want to prevent any more bacteria just gunking up on his teeth again, and calculus buildup. And so we tell him just for a couple of days, give him some soft food, but after that he needs to go back on some hard foods. That way that whenever he crunches on some hard food, it's essentially supposed to kind of help brush his teeth. But if they're able to, what I would tell them is, if they're able to, try to brush his teeth if you can. They do make flavored toothpaste that smell terrible, but the dogs like them. Like this one is poultry flavor, so it's supposed to be like chicken, I guess. I have one at home for my dog that's beef flavored, and it smells horrible. And she didn't particularly care for it, but whatever. So essentially what you would do, here's my toothbrush. You do not want to use, you tell the client, do not use your own personal toothpaste, because A, your dog's probably not going to like it because it's mint, and dogs think that mint is gross. B, there's a lot of fluoride in human toothpaste that, because dogs don't know the idea of spitting, they could potentially swallow it, and if they swallow enough of it, it can become toxic. Just like a child, an infant child, or a small child who doesn't understand that, while it tastes good, you can't swallow it, you need to spit it out. They wind up with fluoride toxicity. So do not use your own toothpaste, use animal toothpaste. So put a little on like you would your own toothbrush, and just kind of brush your teeth like you would your own teeth, and if they'll let you, just kind of brush their teeth all over. At the very least, what I try to tell them, at the very least, try to get those teeth in the back. That's where all that bacteria is just going to sit there and fester away, because that's where you always usually see all that bacteria, that calculus, that plaque buildup. So just kind of brush away, brush. There's tons of diets out there that usually we try to tell our clients, oh yeah, they work great, but while we tell them that, in the back of our minds we're like, it only works if you actually feed it to your animal, but most of the time they're not very palatable, so the animal's not going to want to eat it. So we also try to tell them about these little chews that we have, whether it be a dentist stick from Walmart, which has like the little X design on it. Those are pretty good for teeth. What you want is that chewing motion where they're kind of gnawing on something, and the dogs are always going to gnaw with their premolars and their molars. They're just going to sit there with those back teeth and just gnaw and gnaw and gnaw. That's fine. Like I said, that's usually where all that crap is going to just build up, and that's usually where we have a lot of our issues. And then, so we have the dentist sticks from Walmart, this is an Orvet. Mariel, I think, is the company who makes it. Yeah, Mariel. They are the same company who makes HeartGuard, and they make these little things called Orvet, and this is for a 10 to 24 pound dog, and 10 to 20 pounds, either way, it's a small dog. It has this little design where it's supposed to taste sweet, so that way dogs actually it's something different rather than, oh, this tastes like beef or something. They'll immediately eat it up. Well, this tastes sweet. The whole idea behind it is they're like, oh, well, that's different. Well, let me kind of lick at it a little bit, and then they'll start kind of chewing on it. That's the whole idea of it. So this little outside part is supposed to be like the little chewy part that they're supposed to kind of gnaw on. This inside little part is supposed to be kind of like the toothpaste part. So if they actually start gnawing on it little by little, they'll start to get the toothpaste part, and it'll clean their teeth for them. So that's the whole idea for this. It's supposed to get one a day, usually after a dental, and so that way you can make sure that, because it doesn't work if your teeth are covered in stuff. It's not going to clean your teeth if your teeth are already covered in stuff. So after a dental, we usually try to give our clients these, and if you like them, great, let's keep them on them. It'll keep us from having to put them under anesthesia and clean out their teeth again. Especially if you have an animal that's like pushing 12, and their teeth are so bad, they have dental disease, their breath is horrible. Well, what do you have to fix their teeth? Well, we could put them under anesthesia and clean them up, but they're already geriatric as it is, so we don't want to do that. Well, if we go ahead while they're younger and start promoting their dental health, and start giving them treats that actually promote their dental health and keep them from, building up more crap all over their teeth, calculus, I know I keep saying crap, but calculus all over their teeth, then, and we can start getting them used to stuff like this, maybe it'll be easier to keep their teeth clean, and they'll have fresher breath. Like I said, they're actually not going to have fresh breath. They're going to have dog breath regardless, cat breath. Cats don't usually have a lot of treats to keep their teeth clean, but cats are what they are. But anyway, so this is a good one. We really try to get people to buy these. If they're not going to buy these, please go out to Walmart or at any of your other drugstores and just go buy some treats that promote dental health for your animal. I'm not too familiar about all the diets that promote teeth health. All I know is the one from Science Diet, that is TD. We don't sell a lot of it here at my office, so I'm not too familiar about it. But it's supposed to promote dental health and oral health altogether, and take care of that. But I think that is everything. I think I've covered everything. I'm sorry that everything has come into 2 videos. I don't know why my camera decided to do 2 videos, but I'm just glad that it's recording. So, alright.